Hello, Professor. My name is Jayshankar Iyer, and this is my assignment on the question which you gave all of us in the batch. And in this particular video and PPT, I'll be endorsing the use of blood flow restriction therapy in cases of sports rehabilitation. Okay. So, since I'm a physical therapist, I have seen this sort of therapy back in India, which was used by a couple of physios back home. Okay, so a couple of years ago, this was a relatively newer sort of therapy which was introduced to me by Dr. Durga Pratap, who is a renowned instructor of BFR therapy, across the world, and he has his workshops each every month. So I was sort of intrigued as to how we could use this sort of therapy in helping athletes, getting back to shape after they sustain any sort of injury. So to start off with, uh, the blood flow restriction therapy is a relatively newer training and rehab method which helps people build muscle and strength using extremely light weights. So it works by gently wrapping a band or a cuff around the arm or the leg to slightly slow down the blood flow, which leaves the muscles, making them work harder than usual. This sort of process gives results to us similar to heavyweight training but with much lesser stress on our joints and tissues. So, because of that, BFR is extremely useful for people recovering from any sort of injuries or surgeries who can't lift heavy yet. So, this sort of therapy can basically be introduced to an athlete in the acute as well as the subacute phase of rehabilitation, which is during the first 3 weeks or the first 6 weeks after he or she has sustained an injury or has undergone any sort of reconstruction surgery. Okay, so what started out in the world of sports is now becoming a common and trusted part of physical therapy and rehabilitation programs worldwide. So, now coming to the historical background of BFR, this idea began in Japan in the 1960s with Dr. Yoshiaki Sato, who noticed that his leg muscles were feeling fatigued after he sat in a kneeling position for a prolonged period of time, which seemed to restrict a lot of blood flow. So, after getting curious about the sensation, he began experimenting with controlled blood flow restriction, leading to the development of something which is known as Katsu training. So, initially, this method was only used for muscle building, but it soon gained worldwide precedence and popularity for helping people, you know, who are recovering from injuries to enable them to start with their rehabilitation programs by starting off with lesser weights, if that makes sense, using extremely light weights. So if you load a muscle with a very low amount of weight, which also doesn't cause too much of stress on the joints and the surrounding muscles, that in my opinion would be a huge godsend, okay, in any sort of rehabilitation protocol. And this might also enable the athlete to gain a huge amount of strength within a relatively lesser period of time. Okay. So now coming to the mechanism of action. So the blood flow restriction, okay. So what happens first is when we tighten the cuff, there is venous occlusion with maintained arterial inflow, which creates a localized hypoxic environment inside the working muscles, basically cutting off oxygen supply. So this sort of metabolic stress increases lactic acid accumulation, which in turn stimulates anabolic hormone release. There are two hormones, namely growth hormone and an IGF-1. So this results in a recruitment of fast twitch muscle fibers in an earlier fashion, which mimics the efforts of high resistance training in spite of actually putting low amount of external loads. Okay. And finally, as a result of all of this, there is enhanced muscle protein synthesis and satellite cell activation, which leads to hypertrophy and strength gains. And this can be much more beneficial than traditional strength training. Okay, so now this is sort of a GIF which I inserted into my PPT, which showcases, a person doing a bench press with cuffs tightened on both his arms, which essentially cut off blood supply to the pectoral muscles. So this therapy will definitely cause a lot of hypertrophy of the pectoral muscles, which in turn increases strength, you know. So coming to the next slide, scientific there is definitely scientific evidence which supports the usage of BFR therapy in sports based rehab. So according to the study, mm, this analysis assessed the impact of BFR training on various physical fitness parameters in athletes. So so there were 28 different studies amalgamating 542 athletes aged 14 and 26 years. So the results of the study demonstrated significant improvements in strength, power, speed, endurance, and body composition as well. Also, notably, the study also found that higher training frequencies, cuff pressures, and pressurization durations were associated with more favorable outcomes. So, now if we look at the next slide, this essentially compares the usage of BFR versus traditional resistance training. So, if you can see, if we so blood flow restriction uses light loads, which is essentially 20 to 30% of one RM, and traditional resistance training use heavy loads, which is 70 to 80% of the 1 RM weight. So as you can see, blood flow restriction has minimal to low amounts of joint stress, and traditional resistance trainings, as we know, can strain a lot of healing tissues. And also, as you can see, the muscle adaptation differences, the recovery time differences, and the suitability differences are here for you to see. So, coming to the next slide, clinical applications of BFR. So, the first clinical application would be post surgical recovery. So, we can use BFR therapy for patients who are recovering after an ACL reconstruction or a shoulder repair. And BFR allows such patients to regain strength safely using extremely light exercises. Secondly, during immobilization or activity, when someone is in a cast or has restricted movement, BFR helps to prevent muscle loss and keeps the muscles active even with minimal movement. Then, coming to the third point for athletes in rehabilitation. Athletes recovering from injuries use BFR to maintain their strength and conditioning without putting too much stress on their healing tissues. And we can also use this sort of therapy in older adults or weak patients who are, not exactly accustomed to performing close chain exercises. So if we start off with certain basic open chain exercises for them, so BFR can be used as a very massive adjunct for such people so that they gain muscle hypertrophy in a very less amount of time. And as you can see, BFR also has multiple benefits in sports based rehabilitation, which you know, is sort of similar to the slide which I showed you before. Yeah. So coming to the 10 slide, there are definitely potential disadvantages to this technique. So this requires proper supervision. So incorrect cuff placement or pressure can cause a lot of discomfort, numbness, or even vascular complications if not carefully monitored. And this sort of technique is not suitable for everyone. So individuals with cardiovascular issues, varicose veins, hypertension, clotting disorders like sickle cell anemia may not be ideal candidates for BFR therapy. Then third comes the lack of standardization. So different devices and pressure protocols exist, which make it extremely hard to maintain consistent results across clinics or studies. And there also might be initial discomfort or some sort of fear in certain patients, especially during the first few sessions. So, in my honest opinion, I think blood flow restriction has definitely redefined the way strength and recovery are approached in rehabilitation. By amalgamating light resistance with controlled blood flow, it allows individuals to safely build muscle mass, maintain a lot of strength, and recover in a faster manner without, putting too much burden on the healing muscles as well as the surrounding joints. So to conclude this, I would say this method effectively bridges the gap between early recovery and full training, promoting active healing and better outcomes. And if this technique is performed under, you know, near perfect guidance, it in my opinion, would serve as an extremely smart, safe, and highly effective tool for both athletes and patients who aim to regain strength and function in an effective manner. And these are certain references which I used to create this PPT. Okay. Thank you so much.